So today we are going to start the second chapter, that is anatomical terminology. So as usual, before starting the chapter, we'll go through a skeleton of the chapter so that it will be easy for us to understand the whole chapter. So first of all, introduction. So introduction about the anatomical terminology. From this chapter, what do you understand from these words? Anatomical terminology, the terms that are used in the anatomy, which will be useful for understanding. So second is the positions of the body. These positions of the body, which will you commonly use in your practice. So the anatomical position, the fundamental position, other positions of the body, like what is supine position, it's also called as recumbent position, and prone position and lithotomy position. And second, we'll discuss anatomical planes of the body, like first one, mid sagittal plane, also called as median longitudinal plane, and second one is sagittal plane, also called as parasagittal plane, and there is another plane, the coronal frontal plane, and third one is the transverse plane, also called as horizontal or cross-sectional plane. So the anatomical terms in these are descriptive terms, will describe the structures one to the other with various terms, like anterior, posterior. It's anterior to that structure, it's posterior to this structure, like we'll describe anterior, posterior, superior, inferior, central, peripheral, median, medial, lateral, intermediate, and external, internal, superficial, deep. The structures will orient the type of orientation they are on. So we'll describe through these terms: ventral, dorsal, cranial, rostral, caudal. So we'll describe like this. And see, if you see the special terms used for the limbs: proximal, distal, radial, ulnar, tibial, fibular, preaxial, postaxial, flexor surface, extensor surface, palmar surface, volar surface, plantar surface. And if you look at and if you see the terms used to describe joint movements, like flexion, extension, abduction, adduction, rotation, that is medial rotation, lateral rotation, circumduction, supination, pronation, inversion, eversion, protraction, retraction, elevation, and depression. So these are the terms that we often use in the anatomy to describe the structures, the orientation of the parts or the organ structures in the anatomy. So there are some other terms like invagination, evagination, interior, superficial, deep, ipsilateral, contralateral. And if you see the terms used to describe bony features, the bony landmarks, okay, bone surface marks like depression, openings like foramen, fossa, groove, meatus, sinus, facet, and the projections or processes, bony processes, bony elevations like condyle, eminence, head, crest, epicondyle, line, spine, trochanter, tubercle, tuberosity. See, these are the bony features that the terms that we'll learn, because in the viva the examiner will ask, what is this elevation, what is this depression, what is this process, what's it called as, how it is, feel the surface, touch and palpate, feel the surface. He'll say, so what is condyle, what is head, what is crest, what is epicondyles, what are spines, what is the tuberosity, tubercle. He'll ask. So you should know. We'll study everything in it. The terms used in clinical anatomy, this is very important in your clinical practice also, like analgesia, hyperalgesia, analgesic, anesthesia, paresthesia, paresis, hyperesthesia. And see, inflammation, edema, pyrexia, lesion, infraction, sinus, thrombosis, hematoma, ulcer, gangrene, embolism, lipoma. And see, signs, symptoms, syndrome. What is syndrome? Like diagnosis, prognosis, therapy, convalescence, malingering, degeneration. And see, monoplasia, hemiplegia, paraplegia, paralysis, coma. See, atrophy, aplasia, hypoplasia. In pathology, you'll get to know. So, hyperplasia, metaplasia, hypertrophy, cancer, benign, malignant, carcinoma, sarcoma, tumor, neoplasm, metastasis. These all terms are very much useful in clinical practice. They are like you'll encounter in your field when you go to the clinical postings. You'll encounter everything. This anaplasia, desmoplasia, neoplasia, prosoplasia, dysplasia, compensated hyperplasia. These terms you should know as a doctor, as a medico, as a becoming doctor, upcoming doctor. You should know. See, and if you see the terms of the clinical conditions like itis, like appendicitis, pancreatitis, it's the inflammation. So itis, and ectomy, appendectomy, tonsillectomy, and otomy, hysterotomy, laparotomy, and tomy, like it's the act of cutting in the surgical operation, and ostomy, like tracheostomy, and oma, lipoma, osteoma, hemangioma. So the basic procedure used for clinical examination of the body are like inspection, palpation, percussion, auscultation. We already discussed in the last chapter. And if you look at the terms used to describe blood vessels, so very important though, like arteries, veins, anastomosis, end artery, vena commitans, sinusoids, collateral circulation, capillaries. The terms used to describe nerves and associated structures, nerves, plexus, ganglion, nucleus, tracts, whatever they call, you should know that. Terms used to describe fascia, very important, superficial fascia, deep fascia, fibrous sheath, retinaculum, you should know. The terms used to describe muscles. See, terms used to describe muscles like belly, what is the muscle belly, tendon, what is aponeurosis, raphe, origin, insertion, their origins and insertion, muscle origin. And Viva they'll surely ask what is the muscle origin of this muscle, or what is the insertion of this muscle, biceps muscles, triceps muscles. Everything you should know. And what is bursa or bursa, they are also called as like synovial sheath of tendons, prime movers, water prime movers, antagonists, synergists, fixators. You should know these terms, that will be very much useful for you. And the terms used to describe lymph nodes and lymph vessels. This is very important. So, like lymph nodes, where they are located, location of the lymph nodes, lymph vessels, you should know. So at last, we come to the last page of the skeleton. So the special terms used in dentistry, you should know as a science student, you should know as a medical, you should know what is labial buccal surfaces, mesial surfaces, distal surfaces, palatal surfaces, lingual surfaces, occlusal surfaces. So you should know. And the anatomical nomenclature, this is very important. How the nomenclature have developed in due course of time, how adaptation changes have took place. So most of the terms in the anatomy, in the medicine itself, they are from the Greek or Latin origin. They are Greek or Latin origin. Professor used to call it's Greek and Latin language. So whole medicine is a Greek and Latin language. So they used to call. So Claudius Galen and Andres Vesalius, these are the great anatomists whose works are described into books, and they have terms, some basic terms, like they have recorded everything, their work in books and volumes. They have contributed to the anatomy. In 1895, the German Anatomical Society, like Basel Nomina Anatomica (BNA), have described terms like anatomical terms that are used, that have to be used by every anatomist. So they have six strict rules that were made by this BNA. So those are implemented at that time. So After time pass and the revised BNA, like this BNA got revised because it's not only Germany, right? It's all the world, all over the world should follow it. So no one should have difficulty in understanding or studying them. So revised BNA, like Birmingham revision BR. So in 1933, the Anatomical Society of Great Britain and Ireland came into action, and they have revised BNA. So based on the Gena Anatomica, so Nomina Anatomica in 1935 General Knowledge. So various changes have took place, and at last the International Anatomical Nomenclature Committee, the Anatomical Nomenclature Committee IANC has took the responsibility. Like in 1950, International Congress of Anatomy held at Oxford. After this, every year this conference had took place based on the terms that are to be added or to be deleted or to be changed. Like in 1955, Sixth International Congress of Anatomists had took place in Paris. So nomina anatomica, like nomina histologica, nomina embryologica, like the terms were made, like created in histology and embryology, that has to be followed worldwide. So they have uh, created terms, they passed certain rules and regulations while studying the like histology or embryology. So the important people you should know, like Roger Warwick in 1977, he had described a volume of book, like a fourth edition of Nomina Anatomica, including Nomina Histologica and Nomina Embryologica. And Dr. Vishram Singh had the proud privilege of having a long and fruitful discussion with Roger Warwick in the year 1981. So this is the overall skeleton. We'll study in depth in the next videos.